Hi, I'm Dr. Don Gates, owner and medical director of MyDietSolutions.com. Today I want to address a very frequent question that we get, which is, why don't I support the use of Beta HCG for weight loss? There's several reasons why. First, I want to review what Beta HCG is. It is beta human chorionic gonadotropin, which is secreted in the urine of pregnant women. It's important in early pregnancy to help support the early fetus before the placenta starts making estrogen and progesterone. The beta HCG stimulates what they call the yellow body, the corpus luteum, to produce those hormones until the placenta can take it over. Typically, the levels in pregnant women peak about the 10 weeks of pregnancy and then begin to abate to a much lower level until the termination of pregnancy or delivery of the pregnancy. There is a doctor in Europe who thought that he observed that women gained more muscle mass, became less hungry during pregnancy, and therefore became interested in the effects of the beta HCG outside of pregnancy. He purports that women who take beta HCG have less hunger, develop more muscle mass, have better skin elasticity, and don't experience some of the common side effects that would occur with low-calorie dieting. However, outside of this use that this doctor purports to use for weight loss, beta HCG is only approved by the FDA for the use of infertility. Its main role in infertility is when a lady takes medicine to stimulate her ovaries to mature a bunch of eggs. They then inject beta HCG to ovulate those eggs. That is its primary function outside of what is now becoming popular and non-FDA approved method of weight loss. The other thing I find interesting about these claims of increased muscle mass, decreased appetite, lower fat content in pregnant women, it just flies in the face of reality of what I see every day. How many pregnant women do you know have lower appetites? How many pregnant women do you know lose weight? I would say that a vast majority of my clients that come to me are wanting to lose the weight from pregnancy. Now, it's true there are times during pregnancy that your appetite might be suppressed, like morning sickness, which incidentally does have to do with the high levels of beta HCG in the body, but these are levels many times more than what you would get from taking a shot. And the levels after the 10 weeks of pregnancy stay much higher than what you would get from getting a shot. But I have to tell you that, and I've seen this not only with my wife, but with my clients and patients, when somebody gets pregnant, there is a huge increase in appetite. And that increase of appetite isn't just the first 12 weeks of pregnancy, it goes throughout pregnancy. And that leads to, unfortunately, a lot of us wanting to lose weight after we have the child. It just flies in the face of reality. I don't see anybody, except in rare occasions, lose weight and gain muscle mass and have decreased fat during pregnancy. The other claim that the elasticity of the skin is restored and there is no sagging after weight loss, unbelievable. I can't believe that one either. How many ladies do you know that after pregnancy have loose skin on their abdomen and stretch marks? I thought if beta HCG was this miracle drug, that shouldn't be there, especially in the levels that are circulating in the bloodstream during pregnancy. My main concern when people use beta HCG during a weight loss program is the potential side effects. And they are not minor, which a lot of websites say that they can be minor. If you look on the manufacturer's information sheets, these side effects occur in anywhere from a 3 to 9% of people who use beta HCG in the doses that are being used for weight loss. The side effects, what's the biggest one that's concerned? And it's called ovarian hyperstimulation syndrome. This isn't a benign side effect. It can include congestive heart failure, pulmonary edema where your lungs fill up with fluid. It can include blood clots both in your arteries and your veins. It can include for lack of a better term, screwing up your endocrine system for variable amounts of time, and it can also cause elevations, typically temporary, of your liver enzymes. Those side effects are one of the main reasons why I don't support it. And when you look at the sites on what they use to cause weight loss, universally, they're all low-calorie diets in the range of about 500 calories a day, as well as advocating exercise. It is clear from this that the weight loss is not occurring because of the Beta HCG, but because of the low-calorie dieting. I can guarantee you that if I put you on a 500 calorie a day diet, as well as got you to exercise, you would lose weight, your muscle mass would go up, and you wouldn't have spent the hundreds and potentially thousands of dollars for the Beta HCG. The key to dieting is getting your calories under control, having a sensible exercise program, and not putting your health at risk. I have experience with Beta HCG, and it's interesting, and I'll share you a couple examples. Back when I was a competitive bodybuilder, a lot of bodybuilders who were using steroids used Beta HCG to re-stimulate their testes to make testosterone. They were taking high doses of synthetic steroids, which essentially shut down their body's own production of testosterone. They would use this Beta HCG, which is the main function in guys, is to stimulate the testes to make testosterone, to restart their testosterone production after it had been shut down from chronic use of steroids. Sometimes successful, sometimes not successful. Clearly not a healthy way to go. The second thing is when Beta HCG started to get popular in diet programs here in the United States, I had several patients come into my office and beg me to prescribe them HCG. One patient in particular that I'll share the story with had taken Beta HCG in a program in North Carolina, swore up and down it was the Beta HCG that caused her to lose weight. She was having a frustrating time at my clinic because she wasn't keeping food diaries, she wasn't looking at her caloric intake, and so I acquiesced. I prescribed her Beta HCG because she was convinced that it would work, and we did a comparison. The results? The same. She didn't count her calories, nothing happened to her weight, her inches didn't change, she was wearing the same clothing. I'm telling you folks, it's not a healthy way to go. You take tremendous risks when you take Beta HCG. The primary thing that you want to do is focus in on a good, solid program. Something like a B12 with lipotropics that has no known side effects or toxic syndrome that can combat low energy states when you're dieting on a low-calorie diet, that's a much more sensible choice to do. However, if you take B12 shots, the same principles apply. You've got to control your calories or nothing's going to happen to your weight. But I do not think that Beta HCG is a healthy way to go. If you look at the websites, going to the manufacturer's websites, going to the FDA's websites, searching for why there might be an increase in muscle mass, again, there is no studies listed on these websites. I found on the FDA website that Beta HCG can increase what they call androstenedione, which is a pre-steroid, a precursor that both goes for the production of testosterone and for estrogen. And they found that in females, indeed it does increase the testosterone in females, which would increase muscle mass, which would decrease body fat, more typical of what you would see with a male. However, that effect is not huge. And again, I'm not so sure that most women really want to have the androgen effects of testosterone to higher levels than what would be typical in a female. The side effects can be quite unnerving. These are the main reasons why I don't support Beta HCG. If you're going to be successful, count your calories. Get on a sensible diet program. These are the things that are going to make you most successful. Develop some of the side effects from losing weight, like decreased tone, potential sagging skin. Yeah, add in something like exercise to increase that. That only makes sense, to increase your muscle tone, strengthen the base there. you're having decreased energy from low-calorie dieting, using supplementation, remembering that it's only tools to help you achieve your goal, like B12 with lipotropics, vitamins, makes sense. But please, be sensible. Don't be sold a bill of goods. Use common sense. I hope this helps. Thanks a lot.